I'm Dr. Peter Langenstroer. I'm professor of urologic oncology at Froedtert in the Medical College of Wisconsin. My particular area of expertise is urologic cancers, which include kidney cancer, bladder cancer, prostate cancer, and testis cancer. However, I particularly focus on kidney cancer. My background goes back to 1987 when I started at the Medical College of Wisconsin as a medical student. I completed my residency training here in 1997 and did a urologic oncology fellowship at the University of Kansas. And since then I've been practicing urologic oncology at the Clinical Cancer Center at Froedtert Hospital. At Froedtert in the Medical College of Wisconsin, we can offer a wide variety of treatments for patients with kidney cancer. They range anywhere from very minimally invasive surgical procedures all the way to more advanced patients who need chemotherapy protocols. As Director of Urologic Oncology, I have the pleasure of overseeing and managing and understanding the larger picture of patients who have a wide variety of disease in terms of the locally advanced patients to the patients with just a very small tumors. I have particular expertise in managing localized disease from either percutaneous cryotherapy to laparoscopic cryotherapy to robotic partial nephrectomies to total nephrectomies, or even more advanced cases where patients need to be put on cardiovascular bypass at times to manage their extensive disease. We have the luxury of being able to offer all these options to patients based on what they present with. We have a very large experience at the Medical College of Wisconsin and Froedtert Hospital. We perform more kidney surgeries than almost any other hospital in the state of Wisconsin. We certainly have one of the largest cryoablative therapy series in the country. Currently we're advancing more minimally invasive techniques with robotic partial nephrectomies and still offering all the standard care options that include total nephrectomies and chemotherapy protocols. We have a very high rate of kidney salvage. The goal of kidney surgery nowadays has moved away from the standard of care, which was in the late 90s, which was to remove the kidney for every patient who had some kidney tumor. Now we really focus on preserving kidney function. There's enough data out there now to show that longevity is preserved and cardiovascular risk and hospitalizations are decreased for patients who have kidney sparing surgeries rather than full removal of their kidneys. So our drive at the Medical College of Wisconsin and Froedtert Hospital is really to push that agenda, and based on our numbers, we have the highest renal salvage rate of any other institution in the state of Wisconsin. And we continue to drive that in order to maintain kidney function for patients in an effort to minimize the risk of other cardiovascular and renal failure events that may occur. My patient care philosophy is very patient-centric. I believe that the patient ultimately has the decision and the opportunity to decide what their care should be. As a physician and as a urologic oncologist, it's my goal and my duty to the patient to inform them and educate them on all avenues of treatment available based on the current standards of care. At that point, after educating the patient, I allow them the opportunity to ask questions and then ultimately decide what they choose. It is their prerogative to choose or even not choose care if that is their wishes, and I feel that I'm in the role to honor those wishes, whatever they may be.